Gaza's health ministry has warned of an increase of disease within healthcare facilities. Most of the patients, it says, are children. For more on this, I'm now joined by Paul Spiegel. He's the director of the Johns Hopkins Center for Humanitarian Health. Paul, thanks for being with us. You know better than most that even before October the 7th, Gaza's health system was extremely strained. It was overwhelmed. As we heard from Nizar, who was reporting from Gaza, because of the lack of fuel, multiple hospitals, I think he said 10 hospitals, have been forced to shut down. More than a dozen healthcare facilities have been forced to shut down. UN agencies will be forced to halt operations. This is likely to lead to catastrophic outcomes. I'm talking about desalination plants going offline, water filtration centers not being able to provide clean water. This is a very slippery slope when you look at healthcare.
Indeed, it is. It's very, very concerning. Particularly, we have the acute trauma care that we're dealing with now, but we're also very concerned about potential infectious disease outbreaks, particularly with the very, very poor water and sanitation, and people are not able to drink clean water. Cholera is a very big concern. We have other diseases such as respiratory tract infections that affect children and adults from COVID, influenza, RSV, and other, we're concerned about skin diseases. We already have reports of numerous scabies. And then finally, there will be concerns in the longer term on vaccine preventable diseases like measles and diphtheria, although thankfully the vaccination rates are relatively high before October 7th.
If what you're talking about could be on the doorstep of Gaza, and if you look at the current situation in respect that the aid that is trickling in is nowhere near enough, it's certainly not going to be enough a couple of weeks or a couple months down the line.
No, absolutely. I mean, from a humanitarian perspective, and that's certainly what the Center for Humanitarian Health looks at, there needs to be across the board water, food, medication, fuel to be able to function, not just the healthcare system, but the broader aspects to be able to be prepared to respond to such epidemics. And I would add, we're concerned about epidemics, but the baseline healthcare of many of the people in Gaza was quite low to begin with. And there are a tremendous amount of non-communicable diseases from insulin-dependent diabetes, cardiac, and all of these are going to be disrupted. And what we find in the end, often in the long term, is that these indirect effects of war, in the end, often have a much higher mortality than even the current trauma that we're seeing.
How difficult is it to sort of track and trace some of the diseases or things that could lead to epidemics in a conflict zone that is likely to escalate?
Yeah, it's very difficult in any situation, particularly in conflict. But we're concerned in this situation where if people are not able to report, if the cell phones or the electronic systems are not working, it may even become more difficult. And one of the concerns is that you need alert systems in place as a warning so that you can, as soon as possible, try to respond to reduce the effects and the transmission of any epidemic that may occur.
Okay. Paul Spiegel, thank you very much for joining us here on the News Hour. I do appreciate talking to you.